Yeah, greetings in the name of the Most High. All right, now today I'm going to show a woman how to use a certain product to fight or attack the papilloma virus in the cervix, HPV, how to get rid of it. All right, but you know, a lot of people are misinformed about the human papilloma virus. So we're going to try to teach women about dysplasia, because sometimes you have dysplasia and you don't have cancer in the cervix now. We're going to try to explain to you what happens. All right? Now, we put up a post on the pork the other day, on the pig, the pig. And we had mixed views. Some people say everything is clean, God created everything to eat, so we should just bless it and eat it. And I'm saying, well, how come God create all creatures that is good, so we can just take some rat and some roaches and put them in a plate and tell God to bless it? So how come many people who bless in their food ended up with heart disease? And that's why lots of people believe that there's no God, because you're eating all the food, blessing it, and still getting sick. That means something is wrong, ain't it? See? Common sense alone will tell you that. Just have a wisdom now. Have to use the wisdom now. Now, 750,000 people die every year in America from heart disease, coronary heart disease. What caused these troubles? Diet again. So if you're going to tell me that eating pork and bacon and all these barbecue foods that is not good for you, you know what I mean, and have all these good stuff, how come it's giving you so much troubles in your heart? That means it's not good for you. That's common sense. And then somebody said, well, they're training in some kind of medicine, and they know that pork is good and better than lamb and chop. All of them bad. Lamb chops bad, pork bad, beef bad, chicken bad, they're all bad. And eventually they all mess you up in long term. You understand? So I'm saying to people, if you know you're going to eat these foods, because we can't make you stop eating them foods. But when you're sick, you want to stop them eventually though. You have to take some time to clean your system out. And then some person said, oh, the body produce nitrates and saliva and all this kind of talk. Yeah, but some foods do have nitrates and nitrates, but they don't. But she didn't say what the same nitrates and nitrate converts into that cause carcinogenic to cause you to have cancer in your system. She didn't say that though. You understand? So when you talk, we have to know what we're talking about, right? So today we're going to talk about HPV, and I want to hear what I was saying now when I tell you how you can attack the virus in the cervix and kill it by doing certain things. Yeah? We just had a patient, young guy, 31 years old, just came into to me with Hodgkin lymphoma or lymphoma. And since 2010, all the chemotherapy he did, yeah? And they told him, you know what? Go back and eat the same foods, because once the foods are digestible, your cancer would not come back. And now he's here in my clinic today because the cancer come back in his lymphatic system and all the chemo he took, and he's still taking it up to this day. We have to educate our people. We have to educate our people about the medical system telling you to go back and eat the same foods that contributed to you getting cancer in the first place. Don't eat them, man. Stay away from these foods. They're killers, right? Now, when a woman finds out she has the HPV virus or dysplasia, she has to go take what we call a pap smear test. And the pap smear will tell a woman if her cells is turning or mutated. It's called dysplasia. Now, let me explain this to the woman now. Not because you have dysplasia means you have cancer. So dysplasia do not mean that you have cancer in your cervix. That's false information already. Because sometimes what the doctors do, they will scrape some of the cells of the outer part of the cervix and send it to get tested. But they don't tell you that a few things could cause you not to have or to get dysplasia. And let's look at a few things that could cause a woman to get dysplasia. One is smoking. Smoking causes women to get dysplasia. Look at right there, smoking. But control pills also contribute to a woman getting dysplasia, the cell changing. And DES is another hormone they used to put in the chicken. They're still putting it up to this day in the 1950s. And they know now that a lot of the women offspring came down with cervical cancer and even uterine cancer using DES. And it is still in your food chain today. And also douching could also cause the cells to change in your cervix. So it's not only the HPV virus that causes your cells to change. Smoking could cause the cells to have the dysplasia. Birth control pills does that because birth control pills deplete lots of vitamins and minerals in the body. And DES also is a contributor, and douching. That's why we advise women do not douche. Alright, we'll tell you why. Now, another thing again is the deaths they put into the woman, into the chicken and the meat, cause a woman to come down with different form of cancer, not only uterine cancer, but also cancer in the cervix and cancer in the ovaries. That's a fact. Alright? Now, when a woman has cervical dysplasia, she can use a few things to turn the cell, because dysplasia only means your cell just changed from a good cell to a bad cell. Because cells deal with cell division. Sometimes when the woman is lacking in certain minerals, especially B6, B12 and folic acid, her cells could also turn and she could have dysplasia of the cells. They're supposed to tell you that too. So a woman could have dysplasia and she could take 10,000 or 5,000 micrograms of folic acid and the cells could turn back to a normal cell. That's a reality. Alright? Now, when you have the HPV virus now, and you want to get rid of the HPV virus, we use vagistatin, we use unlocking, and we use another product called VX compound. They're what we call antiviral herbs that help to build up the immune system to attack the virus and kill the virus if it's possible. Now, this is called vagistatin. And what we do, we ask the woman if she have vaginitis or she have a discharge, we ask the woman to put up 1 or 2 of this vagistatin in her vagina, but she must clear or clean the area first. So, for instance, you lay on your back, or you clean the vagina area, all around the vagina, you clean the vagina, and then you wash your hands after, and then you take one of this vagistatin, if you have vaginitis or a discharge, and you insert it up in the vagina where it gets into the cervix, and once it gets into the cervix, the next day you're going to see a discharge, a brown discharge, telling you that this herbs in this capsule is getting rid of the vaginitis or the yeast infection that you have. If you have the HPV virus now, you take 3 of this vagistatin and you insert it again, and you're going to push it all the way up till you could feel the cervix and leave it there. And you're going to do this for 1 to 3 months if you have the HPV virus. You understand? The human papilloma virus. And once you do that, this vagistatin with the unlocking start to do what? Start to attack the virus in your cervix. And start to attack it to kill it off in your cervix. A few drawbacks. Once you are using the vagistatin as a woman, you cannot have no sexual intercourse for 3 months, at least. And if you're going to have sexual intercourse, you have to make your partner use a condom. Know that? No, that's a fact. No sex. And you must clean the vaginal area every time you're going to insert one of these vagistatin in your vagina. Right? Now, this another one here, comes from Africa. And lots of women try to keep the vagina as tight as possible. So once you insert this little boy right here into the vagina, you become a virgin again. I will laugh at that, but you become a virgin, you become very tight. And that keeps the vagina tight, but it also cleans the vagina and cleans up the cervix also. Alright? Now, while you're using your vagistatin, you're unlocking, and your VX compound to attack the virus, because unlocking also helps with the dysplasia, fibroids, ovarian cysts, PCOS, and all these conditions that affect the woman. Unlocking with the vagistatin and the VX compound. But when a woman is using these products now, she's going to use beta carotene, selenium, vitamin E, beta carotene, selenium, vitamin E. She's going to use folic acid, 3 to 5,000 micrograms per day, B100, B12, and B6. 3,000 micrograms of B12 and 300 milligrams of B6 and 100 milligrams of all the Bs with the folic acid separate. And then automatically, if the woman have dysplasia of the cells, these things here, because the woman is lacking in them and she become deficient, will also turn back the cell to be a good cell. You understand? That's what it's all about. So not because you have dysplasia as a woman, mean you have cervical cancer. Don't forget that. Alright? Learn that today. Not because you have dysplasia, mean that you have cancer in the cervix. But you could use these products to attack the papillomavirus and kill the virus in the cervix. Because why? Jehovah God is great. And give him all the glory and the praise. Don't give it to no man. Bless and love. Peace. There you go. Boy right here.